This is Pet Life Radio. Let's talk pets.
Welcome to Vet Candy's podcast and Other News, a podcast to expand your idea of what is impacting the veterinary world, veterinarians, and all animal care professionals as humans. We are your co-hosts, Dr. Jen.
And Dr. Jason Chatfield.
If you are not yet a Vet Candy subscriber,
why not?
Please subscribe for free today at myvetcandy.com. You can also reach us at jen@myvetcandy.com.
Jason at myvetcandy.com.
And our topic today is the 2019 novel coronavirus.
Yes, in other news. Wait, the what? Didn't we do this already?
Yeah, we did. And you can tell Jason's so eager and excited because he's actually really loud on this.
Oh, well, I'll fix that. I am very excited. So I guess we'll do it again. Okay, here we go. So in other news,
oh my
the
God,
coronavirus is still around.
Yes, the coronavirus is still very much around. And luckily, Jason, we have been able to get our guest back.
Oh, we like consistency. Consistency.
Especially when it's consistency with an expert on coronaviruses. So Dr. Gary Whittaker is joining us again. Welcome again, Dr. Whittaker.
Welcome back.
Hello.
That's right.
That's right. Hello.
And he still has an accent. So he still sounds smarter than us off the bat.
Yeah, don't get fooled by the British accent. It doesn't really do anything.
We're fooled. No.
Very cool.
Anyway, so we really appreciate you joining us because there's been a whole lot of stuff happening since last we spoke.
Yeah, when was that? Like 3 weeks ago, 4 weeks ago, something like that.
Yeah,
A lot's happened.
It has. I mean, in the life of a novel coronavirus, right? A lot's happened. So we got more people with the disease. We know more about the disease, don't we?
A little. Yeah, we know. Well, we're getting more information. Whether we know more or not, I'm not sure. But we're getting more information.
Well said. Well said.
Yeah, exactly. Very well said. What I do know is that the media has hit the freak out button with this virus probably in the last week and a half. I mean,
well, now
absolutely.
It's the United States, so that makes a big difference, right? And especially in Washington State and California, it's big news.
Yes, it is big news. I mean, so I guess since we last spoke, they repatriated a whole bunch of people. The State Department chartered airplanes and sent them over to Asia, brought the people back, quarantined them at military bases, tested everybody, figured out that, one out of every, 1,000 people or something tested positive.
I think they also figured out their test wasn't all that great as well.
Yeah.
Test, right?
Whether it's the CDC had a test, and then they were about to release it to the state labs, and then stop that, and then I think it was a 3' set, and there was something wrong with it. It came to a 2' set, and now it's been released, and so it's they
had to test their test before they sent it to test. Something like that.
Make sure it was reproducible. Obviously, if we're going to test, we want to make sure the test is the best it can be. So it's important.
Of course,
that's
absolutely.
Right. So which is tests.
Right.
Tests are not easy, always black and white. It's not that little blue line on the stat test that we expect, and we need to interpret. And
now they think they have it down now, right? Is that correct? Seems to be good.
Mm-hmm.
Seems to be accurate. Seems to be repeatable.
Yeah, I mean, but it was a little bit when they first sent it out. It was a little bit like a wah wah, right? Because they didn't have all the reagents correct and everything else, and so. But I think what's really interesting about that, when you have an infectious disease outbreak, normally when you want to get a confirmed positive, right? You get your presumptive positive at your local lab, and then you can get confirmed positive usually at the CDC or a federally accredited lab, and it usually takes a little bit. But it seems with this coronavirus that we jump right to, boom, confirmed positive.
Fast track. I mean, you kind of have to fast track under those scenarios, and so it's not the way you would hope in terms of just rolling out a test and really getting everything validated and all that kind of thing.
Yeah, and also my understanding is the method they're using to test now, testing people and apparently at least one dog, is the PCR, right? And so it's nasopharyngeal swabs, and then they PCR. And PCR is interesting, right? It, like Aunt Jen's tips, if you're taking an infectious disease exam, the answers are always PCR, bats, or the letter C, right? And you'll be good. So I think this falls into that category, right? Like we're doing PCR.
Yeah. So we're detecting nucleic acid of virus. We're not necessarily detecting virus. That's always something to keep in mind. It's not it could be, because viral nucleic acid can come from the environment. The owner could have sneezed on the dog's fur and it was just picked up, in that way. I mean, another thing that comes up a lot is vaccines or prior exposure. This is obviously not the case here, but
right.
If you get it, it's amazing how long the nucleic acid can stick around after a virus is resolved. And the issue now is with we've got these panels. You go, your cat or your dog gets respiratory disease, and it gets sent out to a panel, and there's 10 things on the panel, and comes back with 5 or 6 of them positive, and like, okay, what does that mean?
Yeah.
what is the dog really sick with?
Yeah, cleared that right up, didn't they?
Yes.
Clears that up.
And you know what else though is we always think that PCR is super fantastic, and if you have a negative PCR, then you know that you have a negative PCR.
Right. Yeah. Right.
you may have like bad sample collection, or maybe they weren't shedding at the time, et cetera.
Right. So it's actually kind of hard sometimes to get good nasal swabs or in animals. In cats, especially, putting anything up a cat's nose is not easy. So
yes.
So it's hard.
Might be a bit of an understatement there. So.
Yes. Well, and
thing coming out.
By the same token, like getting an effective nasopharyngeal swab from something like a dachshund, it's also tricky. It's an up close and personal test that you're gathering. And so, but then the other thing is, if you have a positive PCR, you know that there's DNA present, but what you don't know is if it's viable, right? And that was your point earlier.
Yeah. Is it actually an infection? Is it even an infectious virus, or is it just some nucleic acid that's come from either from a former infection or from a vaccine or just from the environment or it's just there and it's not really doing anything.
And so right now, like if we take the case of that particular dog in Hong Kong, and we'll say, Candyverse, none of the 3 of us has any personal knowledge of that case, right? Like we're not involved, we don't know, we're reading the press reports, but they tested the dog with a PCR and they said it was positive, and it's the dog that belongs to reportedly someone who was positive for novel corona. And now they've tested it, I think, 2 or 3 more times subsequently. And they've said it's positive, but they still don't know if that means he's infected. Yeah. And they still don't know if it means he could give the virus away.
It's kind of ruled out the environmental contamination, I suppose. Once that happens multiple times, you can rule that out, but there's still a lot of other things to rule out.
Yeah, I think the press reports it as quote unquote, a weak positive, whatever on earth that means. But that's how they say it in the newspapers. Everybody reads that as a weak positive.
Mm-hmm. And so what would be kind of the next step, do you think, Dr. Whittaker? Do you have any idea? Because I know I've seen an article that said they're going to look at antibody titers to determine if the dog's truly infected. Yeah, I mean,
antibody titers have their own issues. I mean, we have to be careful about cross-reactivity here. We've got, depending on the antibody, that's PCR is exquisitely sensitive. It's specific. You design your probe against a very specific thing. As soon as you get into antibody testing, antibodies are not always that selective. So we have to think about other viruses. That, I mean, we're a beta coronavirus. Dogs do have beta coronaviruses already. The canine respiratory coronavirus is so until we know more about how specific that antibody test might be, we have to kind of think about it. There's often a lot of things to think about with a test that people don't realize.
But couldn't you also have an elevated antibody titer just from exposure, not necessarily infection?
Well, I think the antibody would have to be a response to the infection. So a rise in titer is really an indication of actual infection.
Oh, you're talking about a rising, like if you do paired titers. So if we take a blood sample and then a week or 2 weeks later we take another one and it continues on the upward tick.
There's often some background, and but an antibody titer is clearly indication of infection.
Okay.
The animals mounted an immune response and responded to the infection. So a titer does tell you there's actually been an infection. It's not just the virus is there and hanging out. It's actually infected and caused an immune response. So that does help.
And then, Jason, you sent me an article earlier today, or we were chatting about it, about a drug that people are talking about kind of on the internet, saying, why aren't they treating people with this?
Yeah. So, I mean, obviously there's the FIP, coronavirus in cats, and people found out, lay people found out about, we have some stuff to treat cats. Why are we giving it to humans? What's going on here? Right. So I was actually a legitimate question, and the article basically, it's an interesting article, but Gary, you want to kind of fill us in and see why can't we just use what we're using on cats, even though it's, kind of new? Why can't we just give it to humans and see what happens?
Yeah, well,
that's sort of an idea.
So the whole antiviral treatment of cats has been an interesting trajectory. So it's
tangent.
Yeah,
about the same time.
Very good. There's some really good solid data in publications which is showing that these drugs are beneficial to cats with FIP, but they're not really. They haven't been through FDA approval or testing, and in the meantime, the drugs are available on the internet, and they're not. So there's a lot of questions about.
By internet, do you mean the black market?
Well, yeah, that's the word you want to use. But there are companies. I mean, they're not really the black. I don't know if I want to use the word the black market. There are companies. Yeah, there are companies. So it's not. I think we have to be careful about how to describe these. So there are companies, selling drugs, and but I think I'm accurate in saying these are not FDA approved. So it
would be off-label use at a minimum.
Right.
Yeah, and so, but also what I'm hearing from you is that maybe there's purely anecdotal evidence that it's effective, but no peer-reviewed case studies indicating that it's effective in a large population.
Yeah, there's some. There's studies that maybe would be pilot studies, but it hasn't really been through full clinical trials. Let's say, put it that way.
Yeah, and I think that's what we're facing with the human stuff too, right? That remdesivir. Remdesivir. Who names these things, Dr. Whittaker? Who's naming this stuff?
So that's another situation where sometimes we have to fast track if there's a reason, but we have to be careful when we fast track because these bad things can happen. But remdesivir is another. That's a drug kind of in the same category as the FIP drugs, to be honest. And it started out life as an Ebola drug. I don't know if you know the history of remdesivir. So it came out of an Ebola discovery pipeline. It's my understanding, and it was actually used in the Democratic Republic of Congo. They had the outbreak last year, and it was actually and there were several clinical trials were run.
Oh yeah,
remdesivir was one of the clinical trials. It didn't actually didn't really pass clinical trials for Ebola. But in the meantime, the parent compound or the compound itself was being looked at in cell culture for SARS and MERS, and it was affected there. And
interesting.
And so that's where we come to sort of shunt it off to this COVID-19 now, because it's enough so the Ebola drug now become a COVID drug.
So what's funny about that? There's another drug that now permeates our society that was an accidental finding, right? They were trying to figure out what to do with how to treat, I think, blood pressure in humans. It's a little blue pill, right? Viagra made the market. Right? They discovered that.
It happens a lot. I mean, you can rationally design a drug all you want, but sometimes it just works in a way that you don't predict. And, so we have to be. And there's a lot of interest right now, and I'm doing some of these myself, and just in terms of looking at these panels of FDA-approved drugs that can just be rescreened for a different purpose. And we've got a project right now. We're gearing up with the NIH. They have a high throughput screening, so we're partnering with them to try their platform of drugs which are already approved and been through safety profiling. And so if they do work, then it can be fast tracked because all the safety. Taken care of.
Because the safety's already been evaluated, right? Because it's already been.
It was in clinical trials for something else and it failed, but maybe it can be repurposed and. A bit like the little blue pill. So
interesting.
Certainly a good option rather than starting from scratch. It takes a really long time and it's really expensive. You can short circuit the whole process by repurposing an existing
in a safe way. In a safe way. So we're going to take a quick break. You guys know we got to pay some bills, so we're going to take a quick break. And on the other side of it, I'm going to ask Dr. Whittaker if we should let Jason leave the basement in the face of this COVID-19 outbreak. See if it's safe. So hang with us, and we'll see you on the other side.
Vet Candy makes your life easier with scientific news, clinical updates, and expert lifestyle tips. Sign up for free at myvetcandy.com and start making your life sweeter.
Begging to hear more of your favorite show? Full episodes of all our shows are available on demand. Go to PetLifeRadio.com to fetch our entire lineup of Possum Pet podcasts. Also, dig us up in iHeartRadio and iTunes. Let's talk pets. Live and on demand only from Pet Life Radio.
Okay, welcome back. Welcome back. Where we are chatting with Dr. Gary Whittaker all about COVID-19, which is the darling of the news media these days. So I did promise that I would ask Dr. Whittaker, is it okay? Jason wants to schedule.
I really want to go
once
somewhere.
a week. Yeah, once a week time out of the basement.
I'm terrified to leave now. I don't know. I got to be careful what I read because I shouldn't go anywhere. I shouldn't get in my car. I'm just been stuck. I'm running out of food. So I don't know what's happening out there in the real world here. So can you help me out, my friend?
What I'm concerned about right now is going somewhere and getting quarantined.
Getting stuck there, right?
Listen, I quarantined myself, so that should be no problem for that, right?
Traveling within the United States, I would be concerned. Even getting on an airplane, I'm not too concerned. But going overseas and hitting some travel ban and getting quarantined 14 days, either overseas or in a military base when I get back, is not my idea.
I have a little bit of a question for that. So it's very simple, not sciencey at all, not nerdy like you guys. Who pays for that? If they say you got to be quarantined, who pays? Does anyone know who pays for that? Does the government pay for that? Do I got to pay for that?
I don't know. That came up actually with the Ebola, when people were getting quarantined for Ebola and it wasn't clear. And I'm assuming in this case there's the federal money to pay for all that. But I think there is some question about health, who pays healthcare bills.
Right. Anyways.
I strongly suspect it depends. A, is the disaster declared in that area? Like, did the governor declare the disaster already? And then B, who's ordering the quarantine? Is it voluntary quarantine? Like we're urging you to self-quarantine in your home, then you're gonna be on top of that. But if they're sticking you at a military base, feds are paying for it. Yeah. So that leads me to another question. So based on what we now know, because like you said, Dr. Whittaker, we're finding out new things all the time. I fly on airplanes a lot. And when we last spoke, I wasn't concerned about sitting on an airplane because this is droplet spread. It's not airborne like measles or something. And so I figure if I get on the airplane, as long as I don't touch anything that's wet made by a stranger, I'm okay. Is that still, what do you think about, air travel and stuff now?
I mean, obviously a lot of people are worried. There's no doubt about that. I mean, I see I'm sure the airline companies are looking at very bad projections in terms of planes being full. And so there are people are worried, and it's not measles. It's not going to go all the way across the plane. But if you're sitting right next to somebody,
sure,
then I think it is. There is some cause for concern. Just because in that close proximity, because people are pretty in close proximity on planes these days.
Yeah, and you know what I think? Close proximity on planes. That's an understatement.
I would term it extremely close proximity. It's ridiculous.
Practically sitting in the other person's lap. But so the other thing is that's what so in America, when we get sick, especially when we get flu-like symptoms or cold-like symptoms, what do? Do we go to the doctor?
No, we stay home. I mean,
we quarantine ourselves in the basement typically.
We don't,
go to work.
We go to work, man.
Take some Advil. Go to work. Got to make that money.
Because we're not gonna use a sick day to actually be sick.
No,
right?
That's for vacation.
I know, but I think in the face of this, always during influenza season, when I had people that worked for me, if they came in sick, I said, "Why are you here? Get out! I don't want it." Right? Go home. I think that's one of the biggest things that the government, the CDC is encouraging people: take your sick days, stay home.
Yeah. Right now, that's the message. More than ever, right? Is stay home. Don't take any chances. You don't know what you've got. And
Also, though, isn't it not? You guys know all about this, and you got to correct me. But are you contagious before you're showing signs? Up to 2 or 3 days. That's pretty scary.
Yeah, there's that. That's what's different about
right.
Let's say SARS. I mean, when SARS came along, it was pretty clear that you weren't until you were in clinical signs. It was easy to put people in isolation, but so it was more isolation than quarantine. But that now we're because of this uncertainty and when people are really shedding, that's really tough because it becomes more about quarantine than isolation, and that kind of changes everything.
Yep.
Well, yeah, because isolation makes sense because we can see the person is ill. You can check their temperature and all that. But quarantine is like, man, you could lie.
Yeah.
You could totally lie. So what do you think will happen? So my concern is this. So I think in New Jersey today, they finally, they confirmed a case there. And, I mean, I live in the country, so I don't worry too much about other people in illness unless I go into town. But in a densely populated area like New Jersey, New York City, those places, do you think people are going to panic or what do you think is going to happen?
Well, I hope they won't panic, but I guess there's certainly more, if you're in a city, there's more, it's just really down to density of people. And, I'm here in upstate New York, and I to a large extent, I can kind of not come into contact with people if I don't want to. But if you're in a city and you're on the subway, then you have no choice.
Right. But that's when it's good to know that, sit by yourself on the subway.
Yeah, right.
So also, it's probably a lot to do with my poor memory, as people can attest. But it doesn't seem that the SARS and the MERS and all that stuff from years ago had the same sort of situation in the United States or just in the press in general, where we're totally freaking out. But it does feel like, even though this has I don't want to belittle the significance of the disease, but it does have a little bit of a low mortality rate, and but they seem to be like, I couldn't buy any hand sanitizer if I wanted to. It's like gold out there.
Empty,
it's crazy,
right?
Yeah, and it just seems more so. Maybe it's a press thing. I'm not really sure, but are they right and I'm wrong and I should be freaking out, or is it just a typical kind of mass? You don't want to say hysteria because we're not there yet, but sort of, I got to take care of myself and get this stuff.
Mm-hmm.
I don't know. It just semes like it's more this go around than before.
Yeah, I mean, the message is not so much with hand sanitizer, but with masks.
Yes, for sure.
There's no masks. There's no mask inventory for love nor money in terms of people. I mean, there's certain people who really need those masks and they just can't get them. The healthcare workers, the researchers, who they need those. The inventory is just down to zero. I have colleagues who work on TB a lot, and they get through a lot of N95 masks every week. And
that's a real deal, right?
They can't do that work now because
it's not safe.
Well, but what's interesting about that is, you may not know this, Dr. Whittaker, but in a former life, I am a biological pathogen responder, and you got to get fit tested, right? You got to get fit tested for any respiratory protection, including the N95.
Right. Yeah, especially the N95s. If they're not fit tested, they're not really doing their job. So a regular surgical mask is one thing, but N95 is, and they're not. You've worn these things. They're not. You can't really wear these things for very long. They're not
I'm not choosing to wear that unless I'm being told to by a safety officer, right? It's not fun times. And so I think it's much easier if you're sick with respiratory illness, stay your little rear end at home. Mm-hmm. And or stay at least 6 feet away from me so I don't get your droplets. So we have another friend in the Candyverse, Dr. Courtney Campbell. He's a friend of ours. He's a surgeon, though, okay? Mm-hmm. So he goes back and forth with me. He argues all the time about whether or not something is a reverse zoonosis or not.
Okay.
And so he asked me about this as soon as the dog popped up, and he says, so is this officially, this is a reverse zoonosis because the human gave it to the dog and the dog has not yet given it to a human. So what say you, Dr. Whittaker?
About the dog? Well, that seems to be... Yeah, it seems to be that's what's going on, and I think so we forget about animals getting sick from people, but if we talked about with this COVID-19, that the big question is still where did the virus come from? I mean, it started out being linked to this live animal market in China and in Wuhan, and that's the best link, but people seem to be backing off that it maybe started before that, and
they brought it. The people came sick to the market.
Right, and then the pangolins. Did we talk about the pangolin story last time or not?
No, we talked about the snake. Remember, first they thought it was snakes.
Right,
the snake is gone, but now then the pangolins came up, and that's kind of gone now too. So that
yes,
and that probably is just I wouldn't know it's a reverse zoonosis or not, but just as there's some bat-like virus that acquired human. Infection probably acquired pangolin infection, and it's just a parallel zoonosis.
Right.
I would say is maybe what's going on there.
Well, I would be very ecstatic for it not to be the pangolin.
Yeah.
They don't need any bad press. Poor pangolins.
They already got it.
They already got it for things.
Yeah,
So are you? So go ahead.
Another interesting story about how the release of information through preprint servers is getting very interesting in terms of the science. What the conventional way of publishing is dissipating very fast, and people are trying to get things into preprint servers, and it's not.
Yeah, it's more important to be first than correct.
Right.
So so that's part of the problem. I would agree 100% with that.
Yeah, so we have to get over this idea of the people who are first, everybody trying to be first. Because
at Vet Candy, we just want to be first to provide some transparent, reliable information with caveats on some of the craziness, right? And that's really part of it. Because I'll tell you, people are panicking. There's all kinds of stories coming out. I think a grain of salt with a lot of stories, especially those that are coming out of Asia, where you don't have good sources. It's not legitimate. They're talking about they're killing thousands of dogs. I'm not saying they're not, but I'm also not saying they are. Yeah. Right? I mean, who really knows what's going on over there? And so has your point of view, and then we're going to talk about vaccines right quick, but has your point of view as far as my risk and your risk and Jason's risk of contracting this changed?
Well, it has changed from the sense of that it's clearly in the United States, so the risk of contracting it is clearly changed since we last spoke. Because the virus has moved. I don't think in terms of medical risk, I don't think anything's changed. It's clearly targeting people, elderly people with pre-existing conditions, and I don't think that, as far as I can tell, that hasn't really changed. Medical risk but exposure risk is, for me, it's in New York City and New Jersey now. So all it takes is one person to come up on the bus, and you walk into my office, and then so it's definitely become closer to home.
But I still have to get the schmutz on me, right?
Yeah. Well, yeah. I mean, it depends on it's still this
close contact, persistent contact.
It's not like physical contact, but it's still relatively close contact, I think.
Yeah, but I can keep my personal bubble 6 feet away. Don't get your schmutz on me. 8 feet. 8 feet for Jason.
No,
that's right.
For you. I'm good with 6 feet.
That's right. And you know what? We actually have an interloper who's joined us. He's muted himself, but Dr. Courtney Campbell has joined. I think he heard Dr. Whittaker say he was right.
Okay.
No, listen, I'm just fascinated by everybody's contributions. To be honest, I'm sitting here with bated breath because everybody's contributions have been fantastic. So thank you so much for that. I'll be honest with you. I just wanted to drill down on that reverse zoonosis question. Thank you, Jen, for asking it.
Of course you do, Dr. Campbell, because Dr. Whittaker said you were right. Okay.
Not at all. I just listen, the talking point, the common refrain from the CDC is there's been no documented cases that contact between humans and companion pets, there's been any transmission. And then this sort of this dog from Hong Kong is kind of like a game changer. And so you would agree that just from the contact with humans, it's very possible that dog contracted it from their human. I mean, would you say that is something now that you say it's established, or it's a little bit still too early to make that sort of declarative assertion?
I would say it's still, we don't know the dog is really infected formally, I think. So if it is infected, then it would have almost certainly got infected from a human.
Okay. Thank you for that.
But
because this has happened with influenza in cats, and there's been cats get sick from their humans.
Yes, and dogs and ferrets,
but they don't necessarily propagate that infection. So it's a bit of a dead end. We don't know if this is a dead end situation or not.
You don't know if dogs don't seem to be epidemiologically important in the transmission of it as of yet.
Right.
Also, let's not forget, it's a 200-year-old Pomeranian. So.
Yeah, it's a 17-year-old Pomeranian.
Oh, my goodness, man. Pomeranians are like the heroes of our time. They're just heroes with fur, angels with fur. So
agreed.
Agreed.
We're not talking about Pomeranians. We're talking about the 200-year-old part.
Okay, so let's talk about vaccines then, Dr. Whittaker. So people are talking about vaccine. I know that I see the CDC director up there talking about, and they're talking about fast-tracking vaccines, which freaks people out like me. And all of this. So what do you think is going on with that? We don't currently vaccinate humans for coronavirus, do we?
No, not at all. No.
Yes.
So we do vaccinate some animals, but be careful. I don't think I wouldn't say in general, a success in vaccinating animals is particularly good for coronaviruses, so they're challenging. And
I think we talked about that in coronavirus update number 1, part 1, because we talked about the FIP vaccine in cats.
So we talked about that already. Because I still have this picture of this title of this paper where it just says early death in FIP vaccine in animals due to vaccine. So that's a pretty dramatic title for a paper, and it sticks with me a lot.
That's a less than ideal outcome.
Right.
Oh
so you see early death at the start of a paper, you think.
But they didn't get corona. So that I think I heard something on the news today that said 2 to 3 months is what I think that maybe that task force, the White House task force, was mentioning. They think they're 2 to 3 months away from a vaccine.
Yeah, there's lots of numbers floating around, but I think and Anthony Fauci is coming out. He's the director of NIH, and I think he's saying at least a year. I think it's his response, but I think it's more realistic. That's the amount of time.
Yeah.
So that's really not going to at least deal with this outbreak, because it's not the flu. It's not going to move quite as fast, but it'll be everywhere within a year. And then I think the interesting question is what happens next in terms of is this going to be an infection that just hangs around in the human population now forever?
Right. Or does it burn out? Does it burn out like SARS?
Yeah. But I think SARS didn't really burn out. It was burnt out by public health. So it was really actively dealt with in terms of quarantine and isolation and things. So
I just wanted like a shout out to public health.
Yeah, that was a giant mic drop there. That was great.
I
it didn't burn out. We just took care of it and squashed it in its tracks.
Right.
Forget about it. We're doing the same thing with this coronavirus.
That's right. Well, I'm not sure because MERS-CoV has persisted, right?
MERS is a very unusual situation. That's just sort of, it's not really propagating human to human, but it's just continually coming out of its animal reservoir like every year. It just back and from the camels. So it's, that's just not been dealt with. It's just there. It's within, it's coming, people are getting sick within, and it's spreading within hospitals and healthcare workers, but not really going anything beyond that. This COVID-19 is clearly going beyond that. It's definitely got. So there's a new phrase that I've kind of adopted actually just recently in the past week or so of a CAR coronavirus, CAR, which stands for community acquired respiratory. So this is a term I found in a medical textbook. And so one thing I'm telling people is that this is coronavirus number 7 for humans. So we have everybody's heard of SARS. A lot of people have heard about MERS, but there's also, if I did my math right, 4 other human coronaviruses, which are CAR coronaviruses. So they're causing the common cold. They're just circulating every year. We're not really dealing with them, except we're just getting sick.
So
one quick question I had.
Another CAR, but just a high end one in terms of clearly has more bad outcomes in certain people, but it's
the sexy sensational one right now.
Yeah, right. But it could well be that it kind of goes away and then it just comes back next winter, like influenza comes back, and we just So at that level, developing a vaccine is clearly important because we'll deal with it. Right. With that, we get the flu shot, we'll get the coronavirus.
The corona shot.
Yeah.
And I think Dr. Courtney had one more question.
Yeah, thank you, Jen. So that covers a little bit about prevention, but as far as those who are at highest risk for potential fatalities and mortalities from this, I was wondering as far as treatment is concerned. And I didn't know if you had any updated information in regards to the clinical trials on, I believe it's called remdesivir. They've trialed it in FIP. Have you guys already talked about that? Sorry about that.
We did.
If you've already mentioned it.
Yeah.
We did.
Oh, okay, never mind. So if you've already talked about it, then I will look at that later.
Okay.
Carry on.
Okay, like a blister showing up after the work is done. No, I'm just teasing. We love when Dr. Courtney just like pipes in to the In Other News podcast. It's always fun. So I will ask you this, Dr. Whittaker, a little bit on the spot. I'm not going to ask you, would you rather? Okay.
Okay. Well,
but
another question. I see.
Yeah. But
I'm really ready for this.
Although would you rather turned out to be very popular in the Candyverse. But I would ask you this. So if there are 3 things that you think that veterinarians as humans and as people who work with companion animals who, people hold right here by their face, what do you think are three key things that are like most important things that veterinarians should know about this corona? Could you come up with three kind of top things?
Three things about this. Well, I think it's not particularly new, and a lot of people have never heard of. It's like a brand new virus. It's not a brand new virus.
It's not new.
Not new.
This virus is new, but coronaviruses are not new, and we've been. So that's one thing. Not just for veterinarians, but in general, it's not. And it's not. And there's no evidence really that animals are a risk in terms of getting sick from an animal. I think that's
unlikely.
Except for the 17-year-old Pomeranian, I think.
See,
signalment is important.
200.
Yeah,
it can't be ruled out, but they're not. In general, they're not at risk from a patient that is in their clinic. And then I think there's more back to the travel, and I think maybe I'll end with a concern that I have for our students. Next weekend we're hosting thousands vet students for the SAVMA.
Oh, that's right. You guys are hosting symposium at Cornell.
Right. So, and I'm giving a talk on FIP. So if the conference is still held, then go hear my talk. But everybody's like try to figure out is it going to happen because we're a little over a week away, and it's hard to predict even a week out. It's just really trying to deal with travel right now in terms of there's so much uncertainty in travel, and conferences are getting cancelled. And
I know. Everybody's canceling everything, even in Europe.
What's the right thing to do for this? The students have been planning this for a year, and there's so much work into it. And if it just gets cancelled, then that's just not good.
And think about the Olympians, right? Because the International Olympic Committee hasn't made a decision yet.
More importantly, the most important thing is not they're going to miss Dr. Whittaker's lecture, so we can't. We just can't let that happen. All right,
it's all about the lecture.
Oh, 100%. Right. Whatever that happened every 4 years, but Dr. Whittaker's lecture, I don't have any idea, right? So,
one of my personal thoughts right now is that it was abstract deadline day last Friday for the big every 3-year coronavirus meeting in
oh my goodness,
in the Netherlands in May. So this is starts to be ironic because the coronavirus is going to cancel the coronavirus meeting.
Yeah. Isn't it ironic?
Somebody was telling me that if they do hold it, you've got to make sure that all the experts go on different planes.
Different planes, right?
We can't have everybody go. It's like what they used to say about the people who knew the recipe for Coca-Cola. Right. They all had to fly on different airplanes. Oh, that's fabulous. That's fabulous. Okay, so let's see. So the top 3 things that we need to know are: don't panic because corona is not new. This is just a new corona, right?
Right.
Number 2, at this point in time, it's grossly unlikely that a companion animal is going to give us corona, especially in our exam rooms. So go ahead and hug those kitties and puppies. Just make sure they don't have something else, right? Flu, ringworm, these are things that jump to mind. And then number 3, just make a conscious decision about travel.
Yeah.
If you're going to travel, look at where you're going and all of that sort of thing and be aware.
Right.
But, I think those are 3 things that people ought to be aware of even when there's not a novel coronavirus.
Yeah, right. Yeah.
Number 4, buy stock and face masks. I don't know why that wasn't brought up.
3M.
I'm sorry I was kind of absent. I was with my broker there. We're getting some face masks. I'm good to go for the next 10 years.
You and I have the same broker.
Yeah.
Great.
So what? So you're going to expand the basement, Jason? Are you going to expand the basement so that I have a room there?
Yeah. No. I'm just going to expand my basement.
Oh my God, that's fantastic. Well, Dr. Whittaker, we so very much appreciate you taking time to update us on COVID-19 Part 2. As it continues to dominate our news feeds. And it's wonderful to hear. The good news is that we don't need to panic. We can understand the mechanism of transmission, the severity of illness produced in wet populations, and that information is the antidote to any fear when we're talking about an infectious disease.
Correct information.
Correct. Yeah. No fake news. No fake news. We want real facts, not alternative facts, real facts. And so I guess we will cross our fingers that the veterinary students of the country get to hear your FIP lecture next week. We'll thank Dr. Courtney for popping in.
That was absolutely incredible. Fantastic discussion today. Thanks for your time.
Yeah, we love it. And those of you in the Candyverse news hounds, we'll see you on the next episode of In Other News.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.